You know, it's an honor to be talking about an organization that has been critically essential in my success. And we've enjoyed some success in major comprehensive rehabilitative dentistry. And as a young man, coming out of the Air Force for 2 years, where I was a sort of grade B specialist in periodontics, I got very interested in periodontal prosthesis and had always been interested in myofacial pain and dysfunction. And I prided myself on doing comprehensive examinations. And when I got out of the Air Force, I realized that I didn't totally know how to integrate all of that. And so I began to take courses by the likes of Peter Dawson and Niles Goucher and Jerry Kramer in Boston, and certainly L.D. Pankey. And each of those, and another fellow by the name of Bob Barkley, and in every case, I realized that I didn't know enough. And what was most dangerous to me was I didn't know what I didn't know. And so in one of my courses in occlusion with Dr. Dawson, he recommended that I attend the AES meeting. In those days it was called the American Equilibration Society. We've only recently just changed the name. So I went, and a 2-day meeting in Chicago, and in February, which is not the greatest time to visit Chicago, but I got to tell you, I was blown away. I was mesmerized by the speakers, by Goucher and Dawson and Boucher and Reeder and people who, Ralph Eudalis, people who set the stage for the finest dentistry possible. And I began to learn and began to hear opposing points of view. And one of the things that was really important to me as a young dentist is I was torn between, do I treat it this way or do I treat it that way? And there's always a passionate person that tells you, go this way or go that way. And it allowed me to hear opposing points of view. And I must say that I've taken over 2,000 hours of continuing education in my 34 plus years of clinical practice. And there's no 2-day meeting anywhere that more profoundly affected me and added to my success as a clinical dentist. And inherently then, the success I enjoyed with the people I treated. What's fun now is, at my ripe old age, is people will travel and they'll move, and dentists from around the country will send me photographs of cases I treated 20 and 25 years ago and 15 or 18 years ago. And I can tell you that they would not have been as successful if I hadn't have come to this meeting and to have met the people I met here, to heard the presentations I heard here, and to be able to take those back and then bring them together. There's so many pieces in dentistry. How do we figure out where the periodontics fits the occlusion, where occlusion fits pain? All those issues this organization deals with better than any in the world. We're represented by some 38 countries in our membership. That should tell you something.